Good evening and thank you for joining us tonight at 10. I'm Ashley Campbell. We're going to get to your holiday forecast in just a moment, but first we're on your side tonight talking about the flu just 2 days away from Christmas and what you need to know to help keep you and others safe. Now, right behind me here, we're giving you a look at the CDC's flu tracking website, and you can see both Georgia there and South Carolina are in the high category of cases through December the 13th, which is the latest data on that website. Nationally, the CDC estimates that there have been 4.6 million flu cases across the U.S. since the season began. 1,900 patients have died, including one case in South Carolina. Influenza A is the most frequently reported flu virus so far this season, and doctors say a particular variant is causing a highly contagious illness with intense symptoms, and they come on quickly. Your Gunter Schroeder is on your side tonight, live at our safety alert desk. And Gunner, you spoke with the doctor at Wellstar MCG. What does everyone need to know when it comes to protecting them and others as we get closer to Christmas and more people?
Well, local doctors tell me number of flu cases this year are about the same as past flu seasons. And despite the predominant flu strain emerging after this year's vaccine was created, they say one of the many things you can do to protect yourself, getting vaccinated, if you haven't already, is at the top of the list.
People gather and exchange not only good thoughts but also viruses. Most definitely we have seen an increase after the holiday season. In this case we have an increase leading into the holiday season.
Peak flu season is hitting later this year compared to past years. That's with the mutation emerging after this year's vaccine was prepared.
We may see a slight decrease in the effectiveness of this year's flu vaccine, but that is remaining to be seen. So vaccine remains the mainstay of prevention against influenza.
There are plenty of recommendations for preventing the flu from spreading ahead of the holiday season, and there are things you can do if you happen to come down with the flu.
Things like Tamiflu or Xofluza, these are two medications that are being used for influenza, and they remain effective on this flu strain. So for patients who qualify for treatment, that they have this option.
But above all, doctors say keeping calm about national headlines is most important.
We need to be careful, but we don't need to be panicking about it. The vaccine is still effective, or at least partially effective.
Well, in addition to the vaccine, doctors recommend normal tips like washing your hands, covering your cough, and ventilating your indoor spaces in your house. And while they don't recommend traveling if you are infected, they recommend wearing a mask or face covering if you do.
All right, thanks for that, Gunner. Wanting to have everyone a safe, happy, and healthy holiday season. We appreciate it. Well, the flu is not the only infectious disease circulating in the southeast. South Carolina is battling a heavy measles outbreak as cases are in the triple digits now. The Department of Public Service says there were 9 new cases since last Tuesday, bringing the total to 147 cases in South Carolina alone. Now, we're holding steady from our last update with 224 people in quarantine, 4 in isolation. Most of the cases in the upstate are from school exposures or household members of known measles cases. State health officials are asking you to get vaccinated for the measles if you aren't already, especially ahead of holiday gatherings. Now, this is a live look right now at the CDC's measles reporting map, and you can see there's about 2,000 cases nationally for a disease that was considered eliminated in the U.S. since 2000 because of vaccinations. Texas had a major outbreak earlier in the year, putting it at more than 800 cases. Then Arizona with about 180 cases. South Carolina is the 3rd highest in the nation. Georgia also had cases earlier this year. So in all, experts recommend vaccinations for the flu and the measles. You can head to your state Department of Health website to find providers, or you can even talk with your own doctor.